All right, and we are live. Good morning. Thank you to everybody that's joining us live, and thank you to everyone that's looking at the recap. So today we are going to we're going to continue the All Things Mental Health series, which is a lecture that I made on Udemy and now making accessible to more people via YouTube, Facebook, also sharing on Instagram. And this is, instead of it just being a lecture, it's going to be interactive. So I'll be looking at the chat here and there, seeing what you guys think. Any thoughts? All right. So today we're going to talk about depression. And if we have time, I'm also going to talk about seasonal affective disorder. All right. Without further ado, let's get started. I hope you can see the PowerPoint. So, like I mentioned last week, there's a kind of a format to the way I'll be doing this, where first I'll have kind of that tagline that people might come in with, like, I'm sad all the time for depression. It says depression and anxiety, but I actually broke it up. I'm sad all the time for depression. It's interesting that it does say depression and anxiety because although we're going to be talking mostly about depression today, depression and anxiety are so linked. So much so that someone could be coming in with depressed, like symptoms of depression, but they're really anxious and vice versa. We'll talk about that as well. Something else I also want to talk about, and that will be reemphasized when we go over the symptoms of depression, is that even though this is kind of classic, I'm sad all the time, it's kind of obvious, like they're coming in for depression. A lot of times people don't know that they're depressed. And that may be shocking, but they don't, or they wouldn't call it depression. And so that's another reason why we'll be going over this and why it's so important for people to kind of have like a baseline groundwork for these terms and what they mean. So recognize. So we're just gonna go over the symptoms. These are basically, I think, when I made this pretty much from DSM-5, our guidebook for mental health providers to make diagnoses. And like I said, in no way, shape, or form do I want you to be making a diagnosis on yourself, but I want you to be aware of the symptoms so that you can go see a health provider and say, hey, I saw this thing and it's telling me. I mean, a lot of people already do that from various sources. You see these things, but let me go through them right now. So, at least five of the below for at least 2 weeks. And not only that, any diagnosis, whether it's depression, anxiety, you have to have, it has to affect your functioning or cause you significant distress. Now, functioning, when we say functioning, like what does that kind of mean? There's different domains of functioning. So, does it affect how you're able to do your job? Does it affect your relationships? Like, um, are you not able to communicate with people or interact with people the way you want? Does it affect like basic functioning? Are you not eating? Are you not sleeping? Are you not bathing, showering because of these symptoms? Do you have so much brain fog you can't think? So there's different ways that we mention functioning, but an easy way to think about it is it bothering or messing up or decreasing something in my life that I used to do, that I used to enjoy, or that is something decreasing in my life as a result of these symptoms, or just something just doesn't feel right. I think that's even enough. You don't have to have this high mark. You could just say, hey, I'm not feeling like myself, and still go see a mental health professional, and we could let you know, like, yeah, I think this is something worth treating, or yeah, I think this is something worth talking about in therapy, and we'll get into that when we discuss the treatment options. So here go the symptoms: depressed mood, nearly every day, or you appear depressed to others. So some people may say like, I don't feel depressed, but my wife thinks so, or I don't feel depressed, but my kids are always getting on my case about how down I am. Their report actually might be considered a symptom. So don't poo poo what they say. They might be onto something. Decreased pleasure in most activities. You're just not feeling it. Like you don't want to go out, and when you do go out, it's kind of not the same. Weight loss um, without dieting, like unintentional weight loss. So this isn't like this is you're so depressed. Some people become so depressed that they don't eat, or they don't have an appetite or desire for any type of pleasure, including food, or weight gain. Other people, when they're depressed, they overeat, try to compensate, and soothe themselves and cope in that way. Then there's too much or too little sleep. Um, Moving so slowly, like kind of like almost like a sloth, or very restless and kind of agitated. Fatigued, very tired, low energy, feelings of guilt or worthlessness. Some people think they're like, even if they're like very esteemed people, very accomplished people, they feel like they've done nothing. Or just in general, even if you aren't esteemed, you just have very low self worth, even, that no one should have. It doesn't matter, their accolades or what have you. Decreased ability to think or concentrate. So you're trying to, you're trying to get ideas together. They're just not coming ahead. You're forgetting things. It just feels kind of like you're like moving through like mental soup. And last but not least, which is a big red flag, no matter how many of the other symptoms you can appreciate or not, is thoughts of death or suicide. Okay, all right. Okay, no, I have another lecture on thoughts of death and suicide, but we'll talk about that more because that deserves its own lecture and its own thing. So I'm gonna go now and look at the comments to see if there's any comments. It's a good place to stop. All right, so let me continue. I don't see anything. So there's, I think, with most, oh, we are going to talk about anxiety. I think with most, I think with most of the slides where I discuss like the recovery, it will be broken down into medications, psychotherapy, exercise, nutrition, meditation. I think they kind of all say something like that. All right, so with medications, I likely still put them together. I didn't separate them apparently, because the treatment is for the most part the same for both of them. They look like each other. They're brothers and sisters, cousins, whatever you want. They're close relatives. Usually people have one and have the other, or you don't have one without the other. They're so linked. They even treat it the same way. So medications, we have SSRIs. So that's like Prozac, Zoloft, um, Lexapro. But there's other antidepressants, SSRIs. Those kinds that I mentioned are first line. But you may also be prescribed something like Wellbutrin or Cymbalta. These are other types of antidepressants. Some people, in addition to having depressed symptoms, kind of have a little bit taken up a notch where it becomes they might have a little bit more psychotic symptoms, or the depression is so severe that sometimes you need another medication on top of that to kind of mellow out the symptoms. So then you could also be prescribed mood stabilizers. This is like Lamictal, uh, low dose lithium, or antipsychotics. So Seroquel is a very common one. Risperdal, some people are prescribed that. So even though I don't have any homeopathic therapies specifically, I count those with medications. Not to say that like vitamins and things are medications, but if let's say you see something, or even your own doctor recommended a supplement for depression. Um, I don't have any in this section, but it is possible that they might recommend something. I I um I take that as seriously as if you were taking a medication, because they also have side effects. They can also interact with other medications, what have you. So this is something that, let's say your doctor does not recommend this, the NIH and also Sloan Kettering, Memorial Sloan Kettering, has supplement websites where you can find any supplement. You can find out the interactions that it has with other medications, and you can find out how well does that supplement actually perform in trials. So even though I don't have supplements here, supplements are a way to help with depressive symptoms. But like again, work with your healthcare provider, and they'll find the best thing for you, because all of anything that you ingest could have some type of side effect. I mean, let's be honest. You could eat a tomato, and some of us are gonna have like indigestion. So give the medications a little bit of break. Therapy. Therapy can be effective alone or with medications. Either one has been shown to be effective. One second. So I want to make sure that we do not get interrupted. And there's also like more intense therapies or like procedures like ECT, electroconvulsive therapy, TMS, DBS. But these are things that if you could talk to your provider about those options. They're kind of more intensive, upper level. And then nutrition, exercise, meditation probably are the easiest and the most accessible treatments to any illness, mental, physical, what have you. You exercise, exercise is medicine. What you eat, depending on how you eat, that's medicine. And being mindful is medicine. So that will probably, I'll probably be re-emphasizing that over and over and over and over again. All right. Let me see. Any comments thus far? Nope. Sorry. So let's go. Keep going. All right. So I do talk about anxiety. This right here. When I speak on anxiety, these are the symptoms for generalized anxiety disorder specifically. However, there are multiple disorders related to anxiety. So this isn't the only one. So anxiety for you to meet criteria, but if you have any of these symptoms, even like two or three, still like talk to a healthcare provider about them. So occurring most days at least 6 months. So the threshold for depression is like if you have these symptoms for 2 weeks, yeah. Anxiety, you kind of have to have it for at least 6 months with impairment in functioning or distress, like we talked about. Any disorder, there needs to be that impairment. You can't have a disorder and it not affect your life. So if you have symptoms somehow and they don't affect you whatsoever, in theory you don't have a disorder. But I don't it's very unlikely that you'd have those many symptoms and be like, oh, I'm perfectly fine. But to each their own. So here are the symptoms: worry or anxiety about multiple events or activities. Not only a word, you can't control the worry. And then you can have three or more of these other symptoms, which are like restlessness, difficulty concentrating, irritability. Irritability is a big one. Like, I think it's a big one that people that I don't know is as easily recognized as a symptom of anxiety. Like being more irritable, being more snappy. A lot of that comes from a place of anxiety and not anger and like bad attitude. So muscle tension, like everyone's like my strap, my neck, some people carry their tension in there, but this could be any muscle, and sleep disturbance, not being able to sleep. And if you look at the symptoms list, right, outside of the worry, this explicit worry part, a lot of these share symptoms with depression. So we have the restlessness, the easily fatigued, the difficulty concentrating, the sleep disturbance. So they look a lot alike. So first line again for medications are going to be antidepressants, uh, more specifically the SSRIs, the selective serotonin reuptake inhibitors. So the Zoloft, Prozac, Lexapro, Celexa, Paxil, those type of things. But then we have other medications that we kind of use, but we shy away from these because of the addictive potential. These are also something that you don't really want to use every day long term due to cognitive or like they affect how you might think sometimes, and they might also affect how you move. Like some people experience falls or like dizziness or what have you, but you work with your provider. These medications that I'm referring to are called benzodiazepines. These are Klonopin, Xanax, Ativan, Volume, so those are helpful, and if you work with your health provider, they might be able to work with you to pick a medication that's best. We also use something called hydroxyzine or Atarax. You may have it's similar to Benadryl. That's something that we kind of use as needed for anxiety or panic attacks. The benzos usually come in when somebody's having panic attack. Benzodiazepines usually come in when someone's having panic attacks as well. And just like with depression, uh, psychotherapy alone or with medications can help. So I didn't go over types, but I'll go over some types now. There's CBT, cognitive behavioral therapy, which reviews thoughts, feelings, and behaviors, and then and how they're all linked in like two-way arrows. And if you can control how the thought behind it is if you can control how you think, you can then control how you feel and also control how you act in response to things. So it's kind of like a feedback. We want to make it a positive feedback loop. There's supportive therapy, which most people say talk therapy, where you kind of explore where these feelings are coming from, kind of process things on the day to day, get skills, encouragement in a less like manualized way. And then there's psychodynamic therapy. Most people think about that as being on the couch, but it's less manualized. It's the least probably manualized, even though there's like a range of what psychodynamic therapy is. But that's kind of where you kind of freely talk and in your own way have a discovery of what's happening. But regardless of the therapy, you can do different types of therapy for almost any type of illness. It's just that if you're going in for anxiety, the focus will be anxiety. If you're going in for depression, the focus will be depression. And then once again, exercise, nutrition, meditation, always great. But specifically with anxiety and depression, this might be helpful too. But anxiety, I know this is even more helpful, is doing like a meditation called a body scan, where you kind of examine yourself. You can just type in body scan, and I might have one, or if not, I'll record one. But it's essentially where the guided meditation is having you um, kind of concentrate on anywhere you feel tension, pain, pressure, from the crown of your head to the sole of your feet. And it's therapeutic. It really is. Just being in tune with yourself and figuring out where you're feeling and what. Because a lot of these symptoms we hold in our bodies. That's another thing. So much so that another relaxation method for anxiety is biofeedback. I don't have a lot of information about that, and there's so many different ways that you could use it. But essentially, um, you're you're doing a therapy that's based on your body's response to things. And so when you're anxious, you're kind of elevated. So the point is to see that elevation through your bodily responses and then in different means bringing that down. All right. So as promised, I do have some apps that I do recommend. These are mostly, a lot of these are CBT. You can use them for depression and anxiety, but a lot of them are CBT, so that cognitive behavioral therapy, thoughts, feelings, behaviors, type apps to kind of help process things. So just going through them real quick. Clarity is a CBT based guided journaling app that helps users identify negative thought patterns and practice cognitive reframing. I have clarity. I didn't like it at first until I was able to go in and just like use their CBT tools. So you could just say, hey, I'm having a tough time with this. And it'll kind of walk through like your thought process for how you've been dealing with specific problems. And then it also has guided meditations, a lot of things. So it's worth checking out. Mood tools, specifically for depression, it tracks your mood. There's PHQ-9, which kind of go through those symptoms that we did a couple of seconds ago, and has diary tools and a safety plan, which is invaluable. Safety plans. We'll talk more about that when we had the discussion about suicide. Mood Fit tracks mood, sleep habits, lifestyle factors. Also CBT informed. Wobot AI, AI driven chatbot that delivers CBT strategies, and has like does brief conversations. And Sanveo, one in all in one mental health app combining mood tracking, CBT tools, mindfulness. So great, right? You got an app for that. Now, really quickly, I do want us to make sure we talk about seasonal affective disorder because this winter is brutal. This winter is so brutal. So I think this is the best time that I'm doing this lecture series, and this came up as one of the things to talk about. So, what is seasonal affective disorder? Essentially, increased low mood and depression during the winter months. Why? Less sun, less serotonin. Sun is the, I mean, sun. Serotonin is a happiness transmitter, neurotransmitter, which means that when you have less of it, it's thought that that affects your mood. And another reason why we have seasonal affective disorder is less vitamin D. Vitamin D helps us make serotonin. So go figure. It's just a big feedback situation. Another thing that I found out, another reason is just you don't do as much in the winter, or a lot. Some people associate winter with doing less and being indoors and being shut in, and psychologically, that also plays into seasonal affective disorder. So treatment. First, we're gonna have try bright light therapy. Bright light therapy is amazing. So the biggest thing about bright light therapy is that they sell them, but there's certain rules that you want to adhere to if you get them. You want to get a light that is 10,000 lux. Lux is a measurement of brightness over distance. So when you buy it, even though it says 10,000 lux, you have to read the manual and say how far from your face should you put it. So even though it's 10,000 lux, it might be 5,000 here and 10,000 here, if that makes any sense. So you want a 10,000 lux lamp, and you want to have it as close to your face as they recommend. I used to have one in here. And then you also want to use it for about 10 to 15 minutes, maybe even 30 in the morning when you're getting started. Do not use it at night. And people who have been diagnosed with bipolar or have suspicion that they have bipolar disorder probably shouldn't use it that much. Or they should consult a healthcare provider. Actually, everything in here, you want to consult somebody before you try anything. And that's a very effective way. It really helps. Bright light therapy can also help with like anytime that you need to readjust your circadian rhythm. So invaluable to bright light. Putting that bright light on makes a big difference. It kind of wakes you up when you don't want to wake up in these dark months. Take vitamin D3 supplement. You're not getting it from the sun, so you got to get it from somewhere. And I like sports research, all their things. So I'll have some links to that in the notes when I put the notes up for this one. And then also magnesium. Magnesium is amazing. It helps you sleep. So I take that at night. And I also have some recommendations for that in the show notes. So essentially, oh, and one more thing that I don't have here, therapy is still a treatment for seasonal affective disorders. There's CBT for seasonal affective disorder. So that kind of concentrates, one of the things that they concentrate is what I talked about earlier, where People don't get out as much and they feel sadder, and just helping people reframe how they think about the winter months and this time, and also giving them skills so that even though they feel sadder, it doesn't have to like snowball into something bigger. All right, so next time we this is a preview. We'll be talking about suicide. It needs its own time for us to talk. And I just thank you for joining me. Thank you for joining me on this talk about depression, anxiety, and also seasonal affective disorder. We did a little bit of time. Let me look real quick to see if there's anything on the the chat. I don't see anything. But regardless, if you have something that you want to add to the chat, like if you want to, like if you do a replay and you see it and you're like, hey, I think this and that, please add things, because still that, we can still help each other communicate as a community. So thanks again for streaming, and I will see you guys in a couple days. Bye.